What is a cervical biopsy? A cervical biopsy is a procedure that is performed to remove tissue from the cervix to test for abnormal cells or precancerous conditions. The cervix is the lower part of the uterus that forms a canal which opens into the vagina and leads to outside the body. The tissue that's removed is then closely examined under a microscope. A cervical biopsy is normally performed during a colposcopy or Pap test. The amount of tissue your doctor removes is dependent on the type of biopsy being done. A cervical biopsy does not hurt, but you may feel some pressure or cramping. While a vaginal biopsy can cause pain, your doctor may administer a local anesthetic to help numb the area. You must avoid tampons, douching, and having vaginal intercourse for a week after your biopsy. Make sure to ask your doctor when to expect the results. These results will determine if you need any further testing and treatment.